Welcome to the podcast. This is first in the series for Temecula. Today I have a very special guest. We call him Dr. T. Doctor, how are you doing?
I'm good. Thank you so much, Warren. I'm really excited to be here. Thank you for inviting me, and I'm looking forward to share what we can offer for the wonderful people that live here.
Yeah, okay, let's start here. So tell everyone how to pronounce your name.
So my name is Dmitry Tsvetov. I was originally born in the Ukraine, so that's the kind of Eastern European aspect to it. Everybody calls me Dr. T because yeah, it's a little bit
Yeah,
challenging to pronounce
yeah,
my last name. So Dr. T, Dr. Dmitry, either way, I'm good.
okay. So you got a very special business, okay, and there's a lot of aspects that to me are different to to your competitors. But let's first talk about what exactly you do.
Absolutely. So, at my business, Temecula Dental Implants and Oral Surgery, we are able to offer our patients a chance to rebuild their dental health, especially in situations that are far beyond what a typical, let's say, dentist can do. For example, patients who've been wearing dentures for a very long time, they've already gone through 2 or 3 sets of dentures that just do not fit. Patients are not able to eat what they want to eat. They don't feel comfortable. For example, in social situations, they're afraid their dentures are going to fall out right in the middle of a conversation, and it's a very awkward and very uncomfortable situation to be in. Also, very similarly, patients who are just kind of at the end of the road in terms of their dental experiences. They've been going to the dentist oftentimes, every year, and every single time they go there, something else comes up. Oh, this tooth needs a crown. You need a root canal here. This is now failing. Now we have to do this. Now we have to do that. Our patients that come to see our help are basically at the end of the road. They're sick and tired of dealing with the dental issues. They're looking for a solution that is going to allow them to be able to enjoy their food, feel comfortable, feel confident, be able to smile, be able to rebuild their self-esteem, and oftentimes get back into the dating scene, be able to find the job that they've been looking for. So we just do our best to try to help them.
Okay, so firstly, let's differentiate you between a normal dentist. You're not a normal dentist by
I'm
any
not a
means.
I'm not a normal dentist in the sense that what we offer at my practice goes far beyond what a typical general dentist can do. Not only can we place dental implants, which is a fairly significant procedure in terms of the skill level that is involved, also at the same practice, we're able to restore those implants, meaning we are able to give the patients the crowns and the permanent bridges that go on top of those implants.
Okay. Where did it come about, this four all on four? Because it's an all on four procedure you use, correct?
Yes, all on four, and just for the audience who may not be familiar, what it involves is basically a total replacement of all the existing failing teeth in one arch, let's say upper or lower, or both, oftentimes, with a set of dental implants and prostheses that are able to then restore their functionality, aesthetics, ability to chew, and like I said, basically the confidence and the ability to speak and to enjoy everyday normal situations. The procedure itself it actually goes back to about over 20 years now, and it was first developed in Portugal by a very smart gentleman by the name of Dr. Paulo Malo. He was originally an engineer by trade, and then he became a doctor. And he was actually the first person who showed that placement of dental implants in a specific all-on-4 configuration is extremely successful, very predictable, very cost effective, and at the same time is able to give the patients the outcomes that they're looking for.
Okay. And how long have you been doing this?
So the all-on-4 procedure, my very first procedure, I actually did, I want to say in 2014. And I mean, I was aware about it even going further back. However, it wasn't until I personally visited Dr. Malo's clinic in Portugal, and I was fortunate enough to observe him work, and I was able to see what a tremendous difference it makes in patients' lives. And that's when I realized, okay, I really need to bring this to my practice. I need to be able to offer this to my patients, and the rest, as they say, is history.
Yeah. And how does someone qualify for that? I mean, you got a couple of broken teeth and things like that, and how do you decide, okay, because it's a big decision. How do you decide, okay, I'm going to go see Dr. T, I'm going to have all my teeth taken out and replace it with an all-in-4? What qualifies that person?
Well, it's a very interesting question. I'm really glad that you asked me that. Not everybody is a candidate for the all-on-4 procedure. However, um, I do encourage everyone who think that this is a procedure that they might benefit from to, to contact my office and to come in for a consultation. It's really hard to say, even if it's just over the phone, to understand whether this is a procedure that is truly going to be life-changing for the patient or, in fact, the right procedure for the patient. I want to tell you that probably out of 10 patients that come into my office for a consultation, only about 6 or 7 of them are truly candidates, both on the needs level in terms of, yes, this is the right procedure for them, or on the medical level, like they are a good candidate from the medical standpoint to undergo the procedure. And so if I can, I guess, make a generalized statement, this procedure is mainly for patients who, and it's going to sound really bad, I'm sorry for that in advance, but it's for patients who are in what we call terminal dentition stage. What does that mean? It means that the state of their existing dentition is at such a point where fixing the remaining teeth or replacing the missing teeth far outweighs the time and the financial investment necessary just to do the all-on-4 procedure. Meaning, if the patient was to go, a traditional route where every single tooth is like recrowned or root canaled, some bad teeth are extracted, implants placed, the cost and the time needed would be astronomical. For those patients, a decision is made, obviously, together with the patient, once all of their options are discussed. The choice is made. Okay, yes, the all-on-4 procedure is the right procedure to proceed with. We have situations that actually go both ways, meaning patients can come into my office and they think oh, doc, you know what? I'm just missing one tooth. I just need one implant. And we look at the situation, and the patient, for example, is suffering from severe generalized periodontal or the gum disease, meaning they're losing bone all over the place. And I try to explain to them that, look, trying to put a single implant to replace that one single missing tooth is like trying to replace a broken window on a house that is on fire. It's not something reasonable. We need to look at a more comprehensive approach. The flip side of that is we oftentimes also have patients who are coming in and they're like, doc, you know what? I'm so sick and tired of visiting the dentist and just, spending my time in the dental chair and spending all this money. I just want all my teeth out, and I want a bunch of implants placed. And we look at the situation, we examine it, and I explain to them that, look, okay, it may seem as if the all-on-4 is the easiest solution, but it's not like that particular treatment is without any problems. It's not like you do it and you forget about it. No,
Yeah.
there are instances when it's better to try to preserve your remaining teeth. So
Okay.
it's on a case-by-case basis, basically.
And that's also one thing which we'll get into, because I'm an actual patient of yours, but we'll get into that at a later stage. But one thing I found at your office is the honesty. when we had the consultation, it was, this is how it is. You know, you gave me options, and that's one thing I can say about the office is the honesty. But yeah, we'll get back into that. One question I had. It sounds very expensive, and that's going to be the first thing people say. Oh no, it's too expensive for me. What are the options?
Absolutely. So first and foremost, I want you to understand that when it comes to all-in-four pricing and just the overall costs of the treatment, what the patients may perceive based on what they have heard from their friends or seen on the internet does not oftentimes reflect the reality. Sure, this particular procedure can be expensive in terms of, the amount of money that it costs to go from point A to point Z. However, there are ways that we can make it easier for the patient to say yes to the treatment and take this whole financial burden kind of off the table. For example, I will be completely honest with you that our prices are fully transparent on the website, and anybody that is interested can go to our website and see exactly the options that we offer and how much of a financial investment this would take in order for them to get the procedure done. Our prices are way below what is, the reasonable and expected cost, even if you take, let's say, the whole of the United States or the whole of the world into account. I have had a couple of patients who were even considering going to Mexico or going to, let's say, Turkey or flying even overseas, to get the treatment done. And when they looked and they understood that what they would be spending there is not that much different from what they will be spending here, they realized that it makes no sense to go even down to Mexico when they can get the same product at a better quality of service with the guarantees and with the follow-up care that is required to give them the peace of mind that they're doing the right thing by getting the procedure done here. But to follow up on your question, look, these are really difficult economic times. We fully understand that, and we are there to help our patients in whatever way we can. We have multiple financing options. We work with a lot of companies that offer patients credit to get the service done, and oftentimes it is at zero APR. I mean, it depends on the credit history, but still, um, a lot of our patients, having gone through the consultation process and having realized that this is the procedure that they would like to have done, also reach out to their family and friends, even their employers, and they are thankfully able to find a way to make their dream a reality.
Well, it's quite important that you want to eat again.
Absolutely.
That's
Absolutely.
that's a big thing. And then speaking about eating, so you can eat normal once you had the procedure.
So one of the things about this particular procedure is that on the same day as you have the procedure done, when the teeth are removed, implants are placed, you walk out of the office with the set of temporary teeth which are fixed, not dentures. You have teeth that are firmly attached to those implants placed earlier in the day. The only thing that we ask is that for the first 3 months, patients do a little bit of the softer food diet. What I say is a good measuring tool, I guess, is if you can use a fork to smash your food, then you can eat it. So mashed potatoes, cottage cheese, very well cooked pasta, scrambled eggs, smoothies and yogurts, white flaky fish, all of that is totally fair game. Now, if you have to cut something with a knife or you have to bite into it like an apple or a carrot, we do ask that you stay away from those types of foods for about 3 months. The best example is if you had a broken leg. You don't want to start to walk on it right after the surgery. So you want to give a chance for those implants to heal. And that is why for the first 3 months, patients do the soft food diet. Now, once we have confirmed 3 months after the surgery that each and every one of those implants is healed. And we have 3 separate ways to confirm for each individual implant. I won't get into those details. But once we have established that, okay, implants are totally healed, we now have a stable foundation on which to build the final teeth, then of course, yes, we tell patients now, even with these temporary teeth, you can eat whatever you want. Just please don't try to crack any walnuts or break any ice cubes, because those will actually win. And but even then, it's not a big deal.
Okay. So there's a lot of places that do the similar thing, right? What is the truth about? I mean, a lot of them, their big marketing campaign is you walk out with your final teeth.
Right.
Okay.
Right.
So why is yours different?
Okay, absolutely. So I just want to explain for our patients and for those that are listening that, okay, when you get this procedure done, normally you go through 2 sets of teeth, being the first one being the temporary teeth, which you get on the day of the surgery, and you wear those for about 3 to 6 months while those implants are healing. And then you have the final teeth. The final teeth are something that you're going to be wearing forever and ever. And that's the difference. Now, some offices skip the temporary teeth part altogether. If you're interested, I can go into details, in my opinion, as to why patients are, as to why some offices are doing that. But in my opinion, it's a completely wrong approach. The reason being is because right after the surgery, when you put the temporary teeth in, your gums are swollen, they're bleeding, and those implants are just in the beginning stages of the healing process. Once you put the temporary teeth in, it allows for everything to settle, everything to heal during those initial, let's say, 3 to 6 months. Now, what we do in our office is we then retake all of the impressions of the gums, of those implants, once the initial healing process of 3 months has been completed. Because what happens is during the healing time, the gums shrink. So in effect, they pull away from the prosthesis that was placed on the day of the surgery. Now, if you receive your final teeth right like the following day after the surgery, you're going to develop a huge gap between your natural gum tissue, which has now healed and shrunk, and the prosthesis. And that leads to a lot of the food impaction. It leads to speech difficulties with the air escaping, etc. We avoid that by going through 1 and 2 and 3 and 4 sometimes sets of the temporary teeth after the healing has been completed, to make sure that the patient is totally comfortable with the fit and the functionality of the prosthesis.
Okay. And then once, I mean, for people that have seen your social media, the
Right.
big thing is the apple.
The apple, right. When
Which
they
is the
get
big
to bite
test,
into the apple,
yeah,
yes,
which
absolutely.
is a big thing. Okay, so I want to talk about your business.
Okay.
And the camaraderie ship and the family ship, because as I said before, I'm a patient of yours, and the first thing I noticed when I walked in there, I immediately felt welcome. How did you
Thank you.
build such a community?
Well, Warren, it took us a very long time, but I think it comes down to the overall philosophy of the office. And like you said it, every single patient, every single employee is family. If you want to be successful as a business owner, as a clinician, you want to make sure that, number one, your patients are happy, of course. But also, it's extremely important to make sure that your employees, the people who you spend most of your time with, are happy as well. It starts with building a very healthy, very good culture at work, where everybody, every single person, is working toward the same goal and is engaged in making sure that that our patients get the best possible care, and that our office successfully grows. If you're able to establish that, and I have to say, we've been extremely blessed to be able to find people who share our vision and our dedication to our patients and to the business. If you find those people, which again we have, the rest is just easy. The rest is just making sure that you do the best you can every single day. You put right foot in front of the other, you treat people right, and the results will then speak for themselves.
Well, yes, as a patient, I can tell you it's working.
Thank you,
I
Warren.
mean, every time I go there, I feel like I belong there, and I never want to leave, which is probably not a good thing. But
You're always welcome. And again, I want the patients and the whoever is listening to understand that, look, this relationship between the patient and the office does not end the minute, let's say, the surgery is over. No, it doesn't end the minute the final teeth are being placed. Absolutely not. You become part of the family because every 6 months or at least once a year, the patient is going to be coming back to the office and seeing the same people, talking with us, making sure that the implants are still doing good. We're going to be doing the hygiene for the patient because their success is our success. That relationship, like I said, does not end at a certain point. It's a forever thing. I think that's another thing that's rather unique about us is taking responsibility for your work, taking responsibility for your patients. That never stops. That that continues. And I think also that gives our patients an extra peace of mind knowing that if they run into any issues, any problems, all they have to do is just come back to us and we will get it fixed.
okay, you brought up an interesting point: cleaning, hygiene.
Okay.
How does that infect?
So, just like with anything else, you want to make sure that the investment you have made into your own health is being protected. People go to see their physician once a year for their yearly physicals. We do the same thing. We want to make sure that the implants that we placed are still healthy, surrounded by good bone, there is no inflammation, etc. We want to make sure that patient is able to take care of them in terms of the hygiene. So when they come in once a year, we take the prosthesis out, we examine the underside, make sure there's no like food accumulation, and if there are any issues, we go over the hygiene instructions. We show patients how to use various tools to be able to take care of their prosthesis effectively. And like I said, if there are any issues or problems, for example, there's the bone loss around, let's say, one of those implants, we're able to address it and intercept it at an early enough stage before it becomes a huge problem.
Okay. So a person that wants to have this done, how do they get hold of you?
So we are available by phone. We are available by the internet. We have a good presence on social media, whether it's Facebook, Instagram. Good old Google search can also help patients find us. So the easiest thing to do is just to call us directly. The number is area code 951-302-9100. We are located right off Route 79 South in Temecula, right next to the Temecula Valley Hospital. And we will be delighted to see you for a consultation.
Okay, one last question.
Absolutely.
Why Temecula? Why did you choose Temecula?
Well, it's let me see. Thinking back, so the office has been in business since 2013, and at the time, I was actually in Massachusetts, of all places, having just completed my U.S. Army active duty service in Germany. I moved to Massachusetts, and being a Californian at heart, I always wanted to go back to the Golden State. Um, I was considering whether to move back to the Northern California, where I went to high school, or to Southern California, where I went to college. And so for me, San Diego was always a place that I had a very special relationship with. I love the weather, I love the people, I love the recreational opportunities it offers, from the skiing in the mountains to the beach and to the hikes and everything else. Um, but Temecula was always a place that I found very exciting because it is a growing community. There are a lot of families here. There are a lot of people who are in need of the services that we were offering, and so it just became a natural kind of a destination for us.
Okay, brilliant. Doctor, thank you very much for coming on. As I said, people, I'm a patient. I highly recommend Dr. T. I'll put all the links below. Go check out his website, social media. You won't be sorry. It really changes lives.